Hi, I'm Professor Paddy Dwan. I'm a paediatric urologist, and dealing with twisting testicles is one of the things that I do to help boys who are in extreme pain if it happens. So to explain, the testicle starts up near the kidneys, comes down through the groin into the scrotum, and usually the back part of the testicle is stuck into the scrotum. And there's a slippery surface over the front, so it can move around in the scrotum. The bell clapper deformity is when the testicle is a little bit like the clapper of a bell, so there's a slippery surface all the way around. There's a muscle that, as it contracts around the testicle, pulls up and turns. That's the cremaster muscle, and that can twist that bell clapper testicle because it can rotate and cause testicular torsion. That can occur at any age. It tends to occur in pre-teenage and teenage boys, and it feels like they've been kicked in the nuts. It really hurts. The testicle usually sits higher in the scrotum. It has a transverse line instead of up and down, and it is incredibly painful. The problem is that boys aren't taught that this might happen. So it's so important that we let all pre-teenage boys know that they could twist their testicle. It could happen and they could lose their testicle, so that they don't go to the doctor and say, "My tummy hurts," and the doctor forgets to look at the scrotum. And in Victoria, at least every year there's a boy who loses his testicle because the diagnosis isn't made early enough. And one of the things that I have advocated and researched on is the appropriateness of manual detorsion. So in high schools, let's teach boys, if you feel like you've been kicked in the testicle and you haven't, and it's sitting high in your scrotum, take a photo to prove to other people, move your testicle so it untwists, and then you'd be able to get an operation to fix it so it doesn't happen again, so your testicle doesn't die. At the moment, that manual detorsion is not the common practice, but if at least we have parents and boys know that it's possible, you'll be able to go to the doctor, and as long as you get the operation within 4 hours, you'll have no damage. But let's try and untwist them before you go to the hospital after you've taken a photo, so you've got the evidence and the early blood supply. Testicular torsion can occur in 2 different settings. The first is in the newborn period, where the testicle is in a plastic bag, effectively. And the plastic bag comes down into the scrotum and is initially not stuck. So the twisting of the plastic bag with the testicle in it inside the scrotum is called perinatal testicular torsion. So if you have a baby boy who seems in pain, not just windy, then check whether or not the testicles are okay. If there's a problem, you must urgently get to the doctor and make sure they examine the scrotum as part of the evaluation of that pain. The other form of testicular torsion, which can occur in the newborn period as well, but usually occurs before adolescence and during adolescence and soon after. It's a different phenomenon. The testicle in that plastic bag is not stuck to the plastic bag. So what happens, there's a cremaster muscle, which is the muscle from the groin down around the testicle. When it contracts, it has a twisting action. And as a result, the testicle, which isn't glued in to the plastic bag in the scrotum, the peritoneal layer, in fact, is what it's called, then the testicle itself is twisted on its blood supply, which can be 720 degrees. And if it happens, it's urgent to get that cared for. Manual detorsion can be done. A photograph before that is done gives other people the evidence that allows them to understand the certainty of the pathology. So young boys should know that they can potentially have abdominal pain, testicle pain, which is their testicle twisting, and if it's not fixed within 4 hours, there's damage. If it's not fixed within 6 hours, the testicle will die. So if your boy's got severe testicular pain, You must get to care as soon as possible.